Well, hello, everybody. It's that time again. This is Real Mushrooms for Pets, Facebook Live for August. Man, this year is going by fast. My name is Joni Kamlet, and I'm the director of the Pet and Practitioner departments, and I'm here with my trusty colleague and mentor, Dr. Rob Silver. Hey, Dr. Silver, and show me those pearly whites. There you go. Because we're going to be talking about teeth tonight. We're talking about decoding dental health, what every pet parent needs to know. And, I was thinking about this, Rob. It's something every pet parent has to deal with, particularly if you're lucky enough to have an aging pet, and I'd love to hear your thoughts on dental health for pets.
Okay, well, let's start with the disclaimer, which is that tonight I'm going to do my very best to answer everybody's questions to the best of my ability. But because I don't have a doctor-patient relationship, I can't really give you medical advice, but I will give you information and educational advice regarding your question. So there you go.
Good job.
So, dental health is really important, and in veterinary medicine, that's one of the most important things that we learn to deal with, not just with our dogs and cats, but with our livestock. And we know that when there are problems with dental health, we have problems with difficulty in gaining weight, we have chronic GI problems, and so on and so forth. And of course, for our pets, for our dogs and cats, oftentimes, it can be compounded like that, but we also know that the infections and the problems that happen in the mouth can spread through the body. We know that there's a relationship between dental health and mitral valvular problems in the heart and endocarditis in the heart, and it's not an easy thing to keep clean. Because, as humans, we're taught that we need to brush our teeth almost after every meal and floss. My dentist has a sign up in his office that says, you don't have to floss every teeth, just the ones you want to keep. But, but how are we going to floss, a pet's tooth? And even just brushing their teeth can be a real challenge. And some pets won't even allow that. Sometimes we can just take our finger and rub it across the teeth, because one of the things that we're trying to do when we're brushing the teeth, it really is to remove that biofilm that develops during the day based on bacteria that are in the mouth and saliva and different kinds of proteins and molecules that are in there. And that biofilm captures bacteria, which wind up working their way under the gums and creating gingivitis, which then leads to periodontal disease, which if not checked and taken care of, then can lead to tooth abscesses and tooth loss and oral infections. So dental health is really crucial. It's really important, and it's not always that easy to achieve. There are some supplements and there are some mushrooms, in fact, which can be very helpful. And in fact, one of our products could, although we haven't tested it for dental health, it has all the ingredients in it that could be beneficial for dental health. And we'll talk about that.
Yeah, and when you're talking about how our mouth affects the rest of our body, I think I recall there was a study on dental health and a connection with dementia in humans, which that definitely got my attention. But and I think when it comes to dental health, there's so many misconceptions about how, greenies, dry food, cleaning a dog's teeth, or greenies. And then the other misconception, I think, I'm curious what you think about the non-anesthesia dentals. I'm not a fan of them. And most of the veterinarians I know that have been in practice for a long time are not a fan. But then you're faced with, when you do have to get what's called a prophy, that's the technical name for, the dental work, it's very expensive. And so it's a dilemma, because I think there's so many things that I would do natural options for instead of a surgery, for instance. But when it comes to dental health, if it does come down to, if you have to, have that dental procedure, well, first of all, how to maybe avoid that, but also if you have to do it, like, what do you think about the non-anesthesia dental work? I know I'm putting you on the spot there, but
no, that's what I am here on the spot.
Yeah. And I know it's all over the place with that, but that's where I landed.
I think there's some pros and cons with them. I'm not completely against them. Certainly in pets who have difficulty handling the anesthesia, that we need to do a very thorough cleaning underneath the gum and everything else. For those pets, it may be better than nothing at all. Now, certainly there are a number of things that can be done in home and need to be done, really from the get-go and continued ongoing in a very regular and disciplined fashion that can help to reduce that as a problem. And I think that's probably what we're going to be discussing mostly tonight. But I think that it does serve a purpose. But the reason why vets and yourself and the other part of me that doesn't, the con part of me, is that you can't really get deep, and a lot of the dental disease really develops underneath the gum, in that little space between where the gum and the tooth meet, that you have to get that sharp little thing in there to kind of clean that out. So there's pros and cons, but I think that one of the cons to the anesthesia-free dental scaling is it also creates a sense of that things are okay, because you can't really see the tartar above the teeth, but you can see the tartar. The tartar above the teeth is removed, but the tartar below the teeth you can't see. So it gives you a false sense of security that the teeth are going to be okay. So I think there's pros and cons with it, and I think that at least people are making an effort to do something with the mouth is better than nothing at all.
Yeah, no, I completely, I'm not completely against it, and I agree with all your reasons. I often hear in the pet space how expensive it is at the vet, and trying to gouge. And the reality is that, there does need to be testing before a dog or cat goes under anesthesia, and these are skilled. Usually, it's the technicians that are doing the dental work. It's an expensive process for the veterinary hospital to do the dental work.
It is. Yeah. And it's a major kind of a surgical procedure. Yeah. Oftentimes, there's also the need for extractions. Which is oftentimes done by the veterinarian. You have to do X-rays. So it goes ka-ching, ka-ching, ka-ching. And we have Maine Coon cats in our household, and Maine Coon cats are prone to gingivitis, and and we're talking $800 to $1,000, without extractions, just for a plain old prophy. And it doesn't help that one of our cats has a hole in its heart either, which increases the anesthesia risk. But it's so prevention. So an ounce of prevention is definitely an ounce of
and we're going to be talking about prevention. But my friend, actually, I emailed you about her that she got like a $4,000 estimate for her cat Molly, who needed the dental work. But anyway, we can move into some questions. And hi, everybody. Thanks for the people that are chiming in the comments. Yeah. But before we go there, we're going to start with the promo code. Okay. So for those that are listening, as usual, we have a promo code that we offer, and it's going to be Healthy Teeth 25 for 25% off site-wide until October 31st. So go ahead and take a screenshot of that or write it down, Healthy Teeth 25 until August 31st, which is great because we're having our birthday sale right now, but that's ending today. So you can use this promo code to still get a really nice discount on our products.
Yeah, I don't think that those two codes will work together. They're not additive.
No, you can't. It's one or the other. But yeah, after today, if you're watching the recording and you see our promo code and our sale is over as of midnight tonight, you could still go in and get 25% off with Healthy Teeth 25. Nice. So this is a great question. So Doc Rob, what are the early signs of dental disease in pets?
I think the early sign is the odor.
Yeah.
what you can't see. In fact, I had that conversation this evening with my wife about that, about the fact that, she thinks we need to start seeing signs of dental disease before we get to do a prophy. But I think if you're a little ahead of the curve, you can actually keep it more in check. But so the first sign would be the odor, which oftentimes is a sign of what the bacteria that are captured in that biofilm are doing underneath the gum. And that then follows with some little redness. You can see like a little red line along the top edge of the gum, where it meets the tooth. And that would be the early sign of gingivitis. And then we see that progressing and getting redder and getting more inflamed. Then we start to see, with that kind of inflammation and infection, we start to see the gum line recede. So it shows you more of the tooth. And as that happens, that means that the infection and the problem is working its way down along the root of the tooth, and that's where we start to get the periodontal, go from gingivitis to periodontal disease, which then can expand down to the root and create root abscesses, which can loosen the tooth, which then needs an extraction. And oftentimes the extractions are very difficult to do because you have to cut the tooth, because it's got the big teeth, the big chewing, grinding teeth have like three roots, and they're very firmly rooted in there, even when there oftentimes is an abscess or disease in the roots.
Yeah. And then, those are the early signs. Moving on, like reluctance to eat, or, food, dropping out of the mouth. Like, what are some of as it progresses?
Mm-hmm. Well, yeah, reluctance to eat or weight loss could also be a sign of that,
Yep.
I had some TMJ stuff a couple of years ago that I finally got corrected. I was losing weight, and now I'm not. Now I'm able to gain weight because I can chew.
Because chewing. It's important.
Mm-hmm.
Yeah. So what are some, like, I know, me personally, like, I've never been big. I should have gotten the habit early of brushing my dog's teeth, but she's very resistant to that. I give her
many are.
Yeah. Of course I raw feed her, but I also give her like dehydrated chicken feet or turkey feet, to chew on. The chewing, I mean, that's right how animals in the wild, that's how it's a natural teeth cleaning, chewing on hide or the proper bones, etc. Correct?
The chewing can be very helpful, for that. Yeah.
I don't know. I have a little alarm that goes off to tell me to drink water every 20 minutes. So if you hear a background.
Okay. I recommend, looking at chicken wings and chicken necks and chicken backs raw. I think are probably the best and the safest types of bones to chew on. I worry a little bit about the treats, and I don't mean to offend any of the wonderful companies out there that create them, but they worry me as far as harboring, infection and perhaps being having some excessive lipid peroxidation, because oftentimes the fats are also dried in there as well. I prefer the raw bones that have some flesh on them as well. I think that's a great treat, and it's good for the teeth as well.
Okay, and I would add that it's always important whenever you're feeding like raw chicken wings or chicken feet to keep an eye on your pet. I had a situation where my dog was chewing, and then I heard the chewing stop, and I looked over, and like somehow she hadn't separated the wing, and half went down, and like it got stuck in her throat, and I had to do a little, I had to literally pull it out of her.
Some dogs aren't that smart about that, and so if your dog's not used to doing that, monitor them. Start with just a little bit at a time. Maybe just give them, if you have a wing, cut it in half. Just give them one part of that as well.
Make sure they're good chewers. Yeah, I should have added. I actually heard chew, 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 then nothing, and then a thud. She actually fell over on her side, like she was like she couldn't breathe.
Another admonition about bones is watch the shafts of the marrow bones. Like I've seen for sale frozen
Yeah.
dog bones that are like a long bone. They just kind of keep into sections. And even though they might be raw, which makes them softer than when they're cooked, those kinds of bones are so strong that they also can cause tooth fractures. And
or to get stuck. Like I've seen dogs that have had that marrow bone, like literally stuck under their jaw.
yeah, and absolutely. And so, but those slab fractures that they get from chewing those bones, they're toxic because they slab, kind of opens up this whole avenue where food and infection can work its way up and will necessitate an extraction, under anesthesia.
Yeah. Yeah. And I love just going back to the early signs of dental, and then we'll move on to the next question. I think I love what you said about the smell, about that's like a really good sign, and something that I have just noticed. I mean, it's a little, maybe it's a little bit TMI, but I think sometimes we're so used to being around our dogs that we almost don't recognize the smell, and it takes somebody else to notice when your dog has like a bad mouth odor. It's like, I don't know if you've had that experience where you're around, like, it could be anything. It could be cigarette smoke or this or that. Like you become like attenuated with a smell, so you don't recognize it as being off. So I had that experience where I had to tell somebody that their dog's mouth had a very strong odor, and they're like, "What are you talking about? I don't smell anything."
Mm-hmm.
And so,
oh yeah, I mean, I used to do house calls, and I'd go into houses with cat boxes that were like, oh my God, my eyes would be tearing, and the people that were there, they were oblivious to that. Of course, oftentimes they'd smoke cigarettes too, which, are their smell,
Yeah.
House calls aren't quite as romantic as they're made to.
Yeah, no, they're not. So yeah, friends tell friends when their pet's breath smells.
That's a good one. Yeah, that's a good one.
Hard to do, but it's important.
Well, maybe we should get to some questions now.
Yeah, exactly.
And we can kind of add some more.
MKP, I know it's not a dental question. Oh, well, okay, we'll do MKP after, because they've been waiting patiently in there. But how do I clean their teeth without putting them under the vet's at the vet's office? Do specific mushrooms or blends help? How does diet play a role? Well, we've addressed some of that, but
we addressed the first part of it, and prevention is the best treatment for that, which means to start them right away and get them used to you getting in their mouth, and there's a variety of different things that you can do. I noticed there's one question, or at least a statement from one person that is doing a lot of things that maybe Britta will highlight that, because I think it's some good suggestions. But there are specific mushrooms. There's several studies that I have in my database showing that shiitake mushroom has been very, very effective in reducing the biofilm. The biofilm is a really important part of the progression of dental disease, as is creating a healthy microbiome in the mouth. And so the shiitake mushroom, it plays a role in doing that, as does seaweed. Seaweed also can reduce that biofilm, and there's actually products out there with seaweed in them that have been shown to actually help to reduce the tartar as well. Now, some tartar gets so caked on and so calculus and calcium deposits that you have to, and that may be where using an anesthesia-free dental approach without the anesthesia, can at least remove that outer scale. Which can be helpful. And yes, and diet does play a big role, and all this information about dry food, cleaning the teeth is not true, because it doesn't clean the part of the tooth that's underneath the gum. Plus, dry food is absolutely, I'm not a big proponent of it, but dry food is really high in processed carbohydrates. And these processed carbohydrates also alter the microenvironment in the mouth, alter the microbiome. Carbohydrates feed the bad bugs in the mouth. So that's where these higher protein, lower carb, higher fat diets are much better in terms of the oral health as well.
Yeah, and there's such a misconception about the kibble will clean the teeth.
Well, it's a promotion by the pet food companies, because
Yeah, that's just not the opposite is true. But yeah, let's go back up. So we will get to you, MKP. But you did, Brian. Are you talking about
Brian? I think Brian's
Ron?
comments.
Yeah. So Britta, yeah, there you go, Britta. By the way, shout out to Britta, who's behind the scenes.
Yeah, so Brian, thank you for this comment because it saves us a lot of work.
Yeah, so
I think you're doing a great job, and
let me read the comment first, though, because again, people driving, listening, stuff like that. So Brian says, I feed raw nutritional bones, some whole prey, one TDC, brush teeth every night with coconut oil and baking soda, Teef, which is spelled Teef, in water. Anything else I should be doing? Yes, I use Teef as well.
This is great. I'm not quite sure. I don't know the details of one TDC, but I think what you're doing is great, and that your dog lets you do that is even greater, and sometimes brushing isn't that easy, but you can get like a finger brush and just kind of rub it inside along the gums. And like I say, it's breaking down that biofilm, which is really the important part. And the baking soda helps to change that microenvironment as well. So, and the Teef is an interesting product because it's actually a prebiotic that feeds the good bugs in the mouth and helps to edge out the bad bugs to improve the microbiome. Yeah. So the only thing else that I would recommend doing, would be to add some seaweed and some shiitake mushroom. And guess what? A product formulated that has both of those in it. It's called Daily Dog.
Amazing.
It also has a really excellent probiotic that can also help with adjusting the microbiome in the mouth. So we've got the Daily Dog has the bladder wreck, the seaweed in it. It has the 5 Defenders, which has the shiitake in it. And it's got the Saccharomyces boulardii. It's got other good things too, but in terms of dental health. So I would say that, we haven't tested it, and it'd be nice to get some clinicals on it, and we're gonna work on that. But I would say that would be the one thing that I would recommend on top of all the other excellent stuff you're doing.
Yeah, I agree. The Daily Dog is excellent. And going back to the shiitake, shout out to Rita Hogan, because I know you could probably go to her website. She has a shiitake dental. I know she has talked about creating a shiitake decoction to spray on the teeth and gums. And she has a recipe for that. So Rita Hogan, the Herbal Dog.
Yeah.
And I'm sure it's probably also in her. I haven't read her whole book yet.
It's a big book.
It's probably the recipe is probably also.
It is. I've checked it out.
Yeah. Yeah. So now we're going to go to MKP with a non-dental question. My yellow lab is going blind. Is this breed prone to this disease? And what supplements can I give him to slow down the process? Also, will feeding him raw meals help or not?
Okay. Well,
that's a tough one.
Quite sure what you're talking about. It's probably not retinal detachment. It's probably progressive retinal atrophy in the Labrador, which is a genetic breed, and a problem with this breed that's genetic in nature. And it's not the same as macular degeneration, but many of the same ocular antioxidants that are used for macular degeneration, which include beta carotene and so on, can be helpful. But because it's genetically programmed, it can be a very difficult problem to hold in check or to reverse. Unfortunately, I'm sorry, because I had a blind lab for a number of years, and it's a real challenge, that way. So, well, feeding him, I think, whatever you can do to improve his overall health is a good idea. I don't have a trick for slowing that process down, though. I'm sorry.
Unfortunately, but feeding him raw, it certainly isn't going to hurt. I mean,
no, healthy food, whatever's appropriate for this animal,
is going to be good in the long run. And yeah, it's eyesight and hearing are two that, like, I wish there was a magic supplement for them. And I know it can be, of course, really challenging to have a blind dog. Having said that, I've also seen blind, like dogs. It's amazing how adaptable dogs are, whether it's, and I would imagine cats, whether it's blindness or losing a limb or whatever, they can live a very good quality of life. With
quite a bit about living with a blind dog, and my dog was a rescue dog. So oftentimes when you have a dog that's going progressively blind like your lab, they're already familiar with their environment, and
exactly.
so oftentimes they know where to go, even if they can't see, because they can walk around the dark. And there were things like, if there's a staircase that they might be at the top of, you try to put like a double-sided tape at the top so they could feel that, so they would know where it is. But yeah, it is a real challenge. And he was a 90-pound dog, and with bad hips and bad knees. So, he was my favorite dog ever.
Yeah, sounds like the typical veterinarian's dog, missing a leg.
There's all
these tend to collect the ones that that. Maybe other people would.
Yeah, it's so appropriate. I mean, it's so appropriate for a vet to adopt.
Absolutely.
As much as I might like to have a purebred, I just don't think it's the right thing to do.
Yeah, I hear you. All right, what's the next question, Britta? Wondering if the Functional Feline product is the best product for preventative dental care. I've been giving it to my cats for the last month, and I've noticed a considerable positive difference overall. Yes. It's here for Functional Feline.
Yeah, it is. And so it doesn't have the seaweed in it, unless you got one of our original products, which we did take the seaweed out from that because of the issue with hyperthyroid cats. But yeah, as we were saying, and there's really no reason why you couldn't use the Daily Dog, for your cat, which would have seaweed in it still, because dogs don't have that same problem. That's good to hear. That's great. That's great feedback. Thank you.
So glad. Yeah, I love the Functional Feline, and it's a great product. We're getting some really good feedback from cat parents about the palatability. So just like and it's the kind of the companion product to the Daily Dog, what I call your kind of masterpiece formula. It's really got it's a great whole body support product, covers all the bases. So that's great. What happens if dental problems go untreated?
Well, I think I described it. They just progresses down to, and individual results will vary because, the dental disease is not just a matter of happening because you're not cleaning the teeth. There's some animals that go years and years and years with no dental care at all that have lovely teeth, so it's also a very individual thing, as far as their oral pH and their microbiome and, those sorts of things. But what will happen if things go south, is it will get those root abscesses, which can cause infections, can even cause root abscesses up here, can cause these swellings and abscesses that kind of drain out through the cheek. Certainly mouth odor. The dog may wind up being systemically ill from that infection. You certainly get showering of these septic emboli, which are little pieces of bacteria that come.
Somebody's trying to reach you, Rob.
I don't know. I get so many spam calls; it's ridiculous. I don't even pick the phone up anymore unless I have caller ID, working. But anyway, so it can be pretty ugly. You may have seen some dogs that have these, kind of these gaps in their teeth, and they're looking kind of funny, and they can't chew that well, and they may lose weight.
Yeah.
So it is an important thing to get a handle on, and it's an important thing to get a handle on as soon as you get that animal in your life.
Totally. Ideally, start with it. Like if you get a puppy, oh my gosh, start brushing that puppy. Get that puppy comfortable with with the toothbrushing, all the things, of course, along with touching their paws and clipping their nails and all that stuff. But not all of us are lucky enough to start at the puppy phase, and we've got to deal with the dog in front of us.
But just to interject, sorry.
Yeah, sure. No, go for it.
If you want to smell the best smelling mouth in the world of a dog. Smell a puppy's breath. It's that puppy breath. So
Yes, they should make perfume.
they should-
Puppy breath.
what a
Puppy
great name for a perfume, puppy breath.
I would douse myself in it. I want to give a shout out to Claudia Montoya. Miss Kibbles is with us in the chat.
Hi, Claudia.
Yeah, Claudia. We ran into each other at Super Zoo, which was a giant. Well, I think it's the largest pet event in the country. So we were in Las Vegas last week, learning about all kinds of new products and networking. It was a lot of fun, and I saw Claudia, who owns an amazing pet store in Virginia called Miss Kibbles. Claudia says that she started ozone water rinses tonight. Are you familiar with those, Rob? I'm not terribly familiar with ozone rinses for dental care.
Well, I think as ozone is becoming more and more acceptable, and even some of the machines are becoming more affordable for pet parents. It's a simple matter of ozonating water, which then contains that super oxygen, which has an antimicrobial function, and it's for using it very simply to rinse the mouth out. Maybe they've discovered some way to keep it, to have it in a product that actually still contains the ozone, liquid format. I've seen ozonated olive oil, which is another way you could use, like when you're brushing the teeth, you could use ozonated olive oil and baking soda, just like Brian's using, and that would have more antimicrobial function.
Yeah, interesting. I mean, I know, on the human side, like I do oil pulling, which is, swishing coconut oil around in your mouth. And I know that, was it Brian that mentioned that he also uses coconut oil for dental care?
And actually the lauric acid in coconut oil has an antimicrobial effect. That's the C10 part of it.
Yeah, it's an amazing, it's an Ayurvedic technique. And, you take a tablespoon of coconut oil and keep it in your mouth for a while and swish it around, and you have to make sure and spit it out, not swallow it. And also, tongue cleaning. So I wonder if tongue cleaning would be good for pets as well. I would imagine.
I'm not sure they would tolerate it.
No. Probably not. Another thing that we haven't touched on is the fact that the size of your dog, it makes a big difference. I mean, smaller dogs, are so much more prone to having bad, needing dental care more. Do you find that, Doc Rob?
I wonder why that is. I'm almost thinking that it's not because they're smaller, but because they're less appreciative of the intervention in their mouth.
That could be it.
Small dogs are very protective of themselves and don't like to have too much, in there. But I don't really know why a small dog would have more likely to have dental disease than a larger dog.
I thought it might have just something to do with the fact that the mouth there's just a smaller space. Like
if it's a brachiocephalic breed, like a pug, or a Frenchie, then you definitely have a different shape, in that dental arcade. And sometimes there can be, an overhung lower jaw, or, all malocclusions or things like that are genetic errors from maybe overbreeding or misbreeding. Those could certainly lead to those problems in smaller dogs.
Yeah.
It's usually common in smaller dogs to have those kinds of malocclusions.
Yeah, and actually, we're going to go back in the questions, but it just got me thinking about cats and the FORL, the resorptive lesions, which are just such a tragedy. There's cats that it's almost like they have an allergy to their teeth or something like that. There's probably a better way to describe it, but it's very painful, and often they need to have all of their teeth removed.
I don't have a handle on the causation of that, but what Joni's referring to is not just is one where you wind up getting an erosion of the tooth itself where it meets the gum, and it weakens the tooth, and it also allows the introduction of bacteria and food and debris in there, which then furthers that progression. But you also oftentimes get in these cats this very aggressive inflammatory lesion in the mouth where the gums look red, or the odor is like, it's like dragon breath, and it's a very difficult condition to treat, at least at this point in time. And the best treatment for it, unfortunately, is very aggressive and hard to wrap your mind around it, where they actually extract all the teeth. And even when they extract the teeth, there's some cats that inflammation still persists even without teeth in the mouth.
Yeah. And I think one of the most tragic parts is it happens, it's not, I mean, it happens in older cats, but it can also happen in young cats.
Oh, yeah.
You know, it like I had a friend who had a 9-month-old cat that developed it. And so, this cat was a Maine Coon. Actually, it was his Maine Coon.
They have a greater tendency, but I mean, and this kind of goes back a little bit to our discussion about smaller mouths.
Mm-hmm.
Cats do have smaller mouths, but most of the time their dental disease is not. I don't think it's any worse than than dogs are. In that regard, unless they have that particular disease, which is called feline stomatitis.
Yeah. Before we go to the next question, I'm going to just announce again that we are running a show special for 25% off site-wide until August 31st. If you're listening to us live or see the recording, the code is Healthy Teeth 25 for 25% off site-wide. And as Doc Rob mentioned, it won't work today because it's today's the last day of our birthday sale. So you should go to our website because we have all kinds of cool gifts and promos and specials. You can't combine this with the birthday sale, but after tonight, you can continue to get 25% off site-wide until the 31st using Healthy Teeth 25. So let's move on to the next question. How can I naturally remove tartar, aka hardened plaque, from my dog's teeth? Tried all over-the-counter stuff without much help. Also, senior dogs, so don't want to do too much damage using scrapers.
Well, there's some evidence that seaweed can do that, and there's some products out there that contain seaweed. Clinically, I've not had that great luck with these products in terms of frankly removing the tartar. And when you get that hardened plaque, which is really calcium deposits, you oftentimes the only way to get them off is to scrape them off. Use something that is strong enough to be able to get them off the teeth. Now, scrapers, if it's done by someone who knows what they're doing, aren't going to damage the enamel. And oftentimes, if you're doing an actual dental cleaning, you also do a polishing afterwards, which helps to remove any of the micro etching that those scrapers could do. The best way is to not let them occur, obviously, but that could be wishful thinking. I don't really have an answer for you as far as what specifically over-the-counter stuff could do. The Teef, Teef website does have pictures that show before and afters that show that there is a reduction in the tartar, but not in the hardened calcium calculus type of tartar. That once that develops, it's like mechanically there, and it has to be mechanically removed.
Yeah.
To the best of my knowledge.
And it's tough. It's a catch-22 because this is a senior dog. And so, I'm sure there's a reluctance to put this dog under anesthesia to get a proper prophylactic treatment or dental work. But that's going to be the best way to take care of it. But at the same time, it's a senior dog. So
it may be that, an anesthesia-free dental would be the best way to get that plaque off, and then go with the supplements and in-home and your own cleaning approach. And that might be the best case scenario, least expensive and most effective.
Yeah. It's like, but if you do see dental work, like starting to, I think it's important to think about your dog and their dental health before they get to this point. I mean, not a shame or anything here, but I happen to be in the same situation with my little dog Scruffy. She's 14 and her teeth are actually in pretty good shape. I mean, there's a little bit of plaque, but like I said, I raw feed, I do the Teef, I give her, I do give her the dehydrated. Sometimes I do raw chicken bones, chicken wings as well. But when I went into the vet, they're like, okay, it's time. Like, would you want to kind of put her under anesthesia to do kind of a full dental cleaning? And I'm considering it. And every year, she's in such good health right now. Is now the time to do it to support her aging, because she has a little dog. She's got that little mouth. So yeah, it's kind of a conundrum for me right now. And so, yeah, so I feel, senior dogs and dental work, deciding what to do for sure.
And she's getting older every year.
I know.
While she's in good health is the time to do that.
I know. I went to the vet 3 months ago and looked at them. I'm like, should I be, and that's like, well, nothing is like, her teeth actually look great for her age. So, but, I'm looking and I'm like seeing like, they're not perfect. So do I go through the process now and kind of, it's like, when do you get the facelift, when you're still young and so you stay fresh. I know that's kind of a weird comparison, but I think I've been watching too many TikTok videos of people who've had facelifts, but, or do you wait till, you're so old and then you're all stretched out? But anyway, we'll move back into dogs. So next question from Kim. Oh, hey, Kim. 7-year-old AST Dalmatian, Swiss Shepherd with BACS Wobblers Syndrome. We have a great protocol and we are holding our own. Use 5 Defenders and Lion's Mane. Any other recommendations for your products?
I don't know all these abbreviations.
I'm not sure what BACS is. I'm familiar with Wobblers Syndrome.
What is AST? Is that a breed?
That's what if Kim, if you're on, illuminate us on these because I read it like you were going to go, oh yeah, like I know what that is, but I'm not quite sure either.
Right. Well, Wobbler syndrome, depending on what BACS means, is where you have an instability up in the between the top cervical vertebra and your skull, and because it exposes the spinal cord there, the cervical spinal cord, it can cause problems with hind limb ataxia, and can even be worse in its worst case scenario, especially if that hinge is overly stressed through trauma or activity or things like that.
Yeah.
I don't know that I have a solution for that would be based in mushrooms.
Right.
I think the lion's mane is probably a good idea because of its support of neurotissue. That's kind of as far as I can go with that one.
Oh, American Staffordshire Terrier. Thank you, Jill. AST, a pity. An American Staffordshire Terrier. Is what AST is.
It's funny because those usually aren't the breeds that we see wobblers in.
No, I was just going to say, during my time in rehab, we worked with a number of Wobblers patients, and I think every single case I worked with was a Doberman. It's common, and unfortunately, just like hemangiosarcoma is kind of leans towards golden retrievers, Wobblers is relatively common in Dobermans. And I'm thinking back to the things that we did, like the underwater treadmill therapy was helpful. People would say that the balance was better with their dogs after the underwater treadmill, and also acupuncture seemed to be helpful as well. Let's move on to the next question. A way to deal with cat food allergies. If cat is on a special urinary stone diet, are there additives that can be given to pets to negate the food's actions, or can an owner find recipes to make food? Well, definitely they can find recipes to make food.
You can, and there are herbal formulas that help to dissolve stones, but the special urinary stone diet, a lot of it has to do with what it does to the pH of the urine. And so there also are ways to externally provide supplements that can either acidify the urine or alkalinize it, depending which type of stone seems to predominate, in this cat. And so in that case, yes, you could probably make your own diet using, I would start with doing a food allergy panel like the NutriScan to find out which foods, ingredients you need to avoid if you're making a homemade diet or trying to find, a more natural diet that's available commercially. And then you could, depending again on what flavor of stone this is, and you can then add supplements to acidify or alkalinize the urine. And then if you can find a veterinarian skilled in formulating Chinese herbs or a Western herbalist that would use certain herbs that we know dissolve stones, that could also be helpful. When I was in practice, I used to have a custom formula that I'd have a Chinese pharmacy make up for me that worked really well to dissolve these stones, most of them.
Yeah. And there are a number of, the Forever Dog 2 book has some, wonderful pet food recipes. And I don't know if they have a specific diet for urinary stones, but that might be a good place to start, by Karen Becker and Rodney Habib. Britta, let's go up to Diane, who says she has I have a 9-year-old chipoo, a Chihuahua poodle, I would imagine. She had dental cleaning last year, but now her liver enzymes are high and she's on a special diet. My concern is sedating her again for another cleaning.
Okay.
Yeah.
This would be a good candidate for anesthesia-free dental. This would be a good candidate for in-home, dental care and the supplements. This also would be a good candidate for the use of a strong milk thistle product, which can help to protect those livers, the liver enzymes. I guess the question is, why are they high?
Yes.
And I think it's always important. There's so many things that could cause elevated liver enzymes, and many of them are fixable.
Right.
It's a good idea to find out what's causing it. Maybe we can fix it.
Yeah. I think that's why this question caught my eye, because whenever I see high liver enzymes, it's like there's some things that are very difficult. It's very difficult to move the dial on blood work, but when it's often with liver, that is something that potentially. Of course, we don't know what's going on, but might be worth the milk thistle and other options to try to get those liver enzymes more in balance. And again, speaks to the importance of having blood work done if you do decide to do any kind of dental work, because very often underlying things are found in blood work in prep for something like a dental work that you wouldn't know what's going on with your pet, because they seem perfectly healthy, but maybe there's an underlying issue that can be caught through the blood work.
It's a shame they can't talk to us and tell us, it hurts here.
No, I know. Oh, Diane says she takes milk thistle and denmarin, they're gonna they did an ultrasound. They're gonna check the labs again in 3 months. So, Diane, it sounds like you're doing all the right
stuff.
All the right things. We hope that the liver enzymes get in balance and you can have the dental work done. Barbara says one of my 6-year-old cats had her teeth cleaned and extraction of one of her canine teeth about a year ago. She now has hypersalivation. Could this possibly be from the extractions?
That's a hard question to answer. Did the hypersalivation occur after the dental, or was it sufficiently afterwards that it probably isn't related? I'm not quite sure how I could explain how an extraction could cause the hypersalivation, but cats can be very sensitive, and they oftentimes hypersalivate when there's something in their mouth that is disturbing to them, whether it's a taste or it's some sort of a structure. Maybe there's some growth in the mouth. Possibly having your veterinarian do an oral exam to look inside, might help figure out what is the cause of the hypersalivation.
Yeah. I hope you.
There's nothing about removing that canine tooth that specifically, is known to cause hypersalivation.
Right. But as they say, anything can cause anything, so it's quite possible. Are there any mushrooms that can make abscesses shrink? That's a good one. That's a good one, Claudia.
Well, abscesses being, these infections. And we know that turkey tail, for instance, or five defenders, which has a lot of turkey tail in it, can be very good to mobilize the immune system to help fight that infection. But I wouldn't rely on a mushroom alone. I would look, to some herbal formulas, maybe something as simple as an echinacea and golden seal. They have a number of different herbal formulas that have very strong antimicrobial actions. Golden seal, berberine containing herbs, are very good as antimicrobials. So I think a combination is like a 1-2 punch. We work up the immune system, and then we have a direct effect on the infection, and that can help. Some abscesses, though, aren't going to shrink. Some abscesses need to burst open to release the pressure in there, and some abscesses, when they shrink, the pus inside doesn't go away, it hardens, and so you wind up getting like a little lump where the abscess was. So I personally believe strongly in lancing an abscess, but that's also because I'm a veterinarian, and that's kind of what we do.
We do like to poke things and see what comes out, don't we?
Well, even like a little hypodermic needle, can help relieve the pressure. Or a big hypodermic needle attached to a syringe, you can kind of pull that pus out of it.
Yeah, absolutely. Britta, what is our next question? Have you heard of healthymouth.com for pets? I've been adding this liquid to my cat's morning food, and I'm wondering if this is better or if mushrooms are better for preventative dental care. I have never heard of Healthy Mouth. Have you, Rob?
I have not.
Yeah.
But I think that, if it's not, if you're asking the question, it's probably not working well enough. So I think that, using mushrooms and using many of the other approaches that we've been discussing so far, I think would be maybe good additives to this healthymouth.com for pets. Like our daily dog, for instance.
Yeah. There's so many, after this is particularly pertinent after having been a super zoo and seeing the hundreds of different companies out there and different supplements. It's kind of hard to keep track of all of them. And it could be a good product. And there's never a bad time to give mushrooms. I mean, I think that all pets, all humans can benefit. There's really no downside, in my opinion. So you can, try both. Or, if you don't think the Healthy Mouth is working, look at something else.
Yeah, we'll look that up later. See what.
Yep. How often should my pet get a professional dental exam or cleaning?
Well, I think I'm a strong believer in annual exams, even just for the sake of the examination itself, to look at the teeth and listen to the heart and, all those different things, check the weight, whatnot. And I think that and so I would say annually, it would probably be the answer to that. But, each pet has their own rate at which they develop the dental disease, and in part due to diet, in part due to their genetics and structure of the mouth and everything else. So it might be that, some pets go for years. Like Ollie didn't get his first dental till he was like 8. His teeth are wonderful.
Yeah.
Even now, he's had one and he's like 11 now.
Well, Scruffy's never had dental work. I mean, at 14, but I know I'm always bragging about Scruffy. I can't help it. She's just the perfect dog. I just love her so much. But Nizelle says, Seaweed doesn't agree with my dog's tummy. What do you suggest? Maybe she's using the daily dog.
If that's the case, then probably avoid the daily dog. I think that the use of some of these seaweed products are topical. I think that they don't have to be ingested. They can be, applied topically while you're brushing the teeth or whatever. But, I think tonight we've had a lot of suggestions.
Oh my, Rob has frozen. I hope you come back, Rob. Well, I'll just keep talking and hope that Rob returns. Nizelle, one thing you can do is try the Five Defenders powder. If you are using the Daily Dog and the seaweed is upsetting your pup's tummy, we do have a combination mushroom product, which is the Five Defenders, which is the reishi, turkey tail, shiitake, which is the mushroom that Doc Rob was talking about, was good for dental health, maitake, and chaga. And so you could try that, putting that in your pup's food, and it comes in a capsule or a powder. Oh boy, we lost Rob now, and I'm here all by myself. I'll tell you what, Britta, we've only got 5 more minutes. We'll see if Rob comes back on. Throw me a softball question, or else I'll just like ramble away about like facelifts. What's the best dental chew for dogs? Too many options on the web. It gets overwhelming. Well, I can tell you the type of dental chews that I don't like, which are like greenies or any kind of rawhide. Rawhides are really, really, really dangerous. I would tell you to avoid like rawhides. They're often unless you're in a boutique pet store where there's somebody, the owner is very sophisticated in the kind of rawhide that they're bringing in, and it doesn't have any chemicals, or often these are just covered with chemicals and preservatives and things that you don't want your dog to be chewing. So that's what I wouldn't recommend. Or like those greenies are I just think they're not a good thing. As Rob and I were talking about, like I like the raw chicken wings. You definitely don't ever want to give cooked bones, but raw bones, the chicken wings, they're very bendy. And the chewing action is just, this is what animals do in the wild. This is, animals in the wild, they're not getting dental work. They're killing their prey. They're chewing, they're eating, chewing on the bones. They're eating the hide. There's a wonderful company called the Real Dog Box. Shout out to Ruby Bellaram, who has wonderful, wonderful chews for pets. And you can actually get a mail order and have them mailed to you. And she has things like, some of them have like fur on them. Fur can actually be really good for chewing and can help almost like a dental floss. So yeah, I hope that helps. It does definitely get overwhelming. I'm going to repeat our promo, which until the end of this month, until August 31st, you can get 25% off site-wide at Real Mushrooms with the code HealthyTeeth25. So you might want to take a screenshot of that or write it down, HealthyTeeth25. Do be aware that if you try to use the code tonight, it won't work because we are having our birthday sale. So right now it's Real Mushrooms' 10th birthday. I can't believe we've been around for 10 years. So it's our 10th birthday, and we have all kinds of specials that are happening. Ends at midnight, so I'll get in there, free gifts, discounts, all kinds of stuff. So I would trot on over and take advantage of our sale. But if you missed the sale, use the Healthy Teeth 25 from tomorrow until the end of the month, until August 31st. The website, Britta, can you drop the website? It's www.realmushrooms.com. I also want to, if Rob were here, he would probably be letting you know that you actually have 2 opportunities to see Dr. Rob Silver every month. We do this once a month pet Q&A on Real Mushrooms, and then on Rob also has his own platform called the wellpetdispensary.com. And once a month, and it's always the Thursday after our talk here, he does another talk. And he mentioned that next Thursday, and you can go to his website, Britta, if you wouldn't mind dropping his website in the chat too. He mentioned that he's going to be talking about epilepsy in pets, which should be a really great conversation. And in the last 30 seconds we have before we end up, I want to thank you for hanging in here with us. It's a great conversation. I'm really sorry we lost Rob. I have a feeling he must have had a power outage or something like that and I'm sure he's freaking out trying to get back on board. But anyway, it's been a pleasure. And we will be back next month. I'm not sure what our topic is next month, Britta. If you know it offhand, you can drop it in the chat. Otherwise, we will see you next month. And y'all take care of yourselves and your pets. And this has been a pleasure. And thank you, Britta. Oh, cats. Oh my gosh. Yes, cats.